Hi, everyone, and welcome to the webinar on popular diets and their impact on diabetes. As you know, the presentation today is sponsored by the Good Health Gateway. I do want to thank you all for being here today, especially given, the uncertain times that we're facing right now due to COVID-19 or the coronavirus. I think our topic today is really relevant, kind of in light of this virus, as maintaining a healthy and balanced diet is, really key to staying healthy, and, just eating healthy kind of is an indication of your overall health. So a balanced diet is key right now. So we do understand that these times are really challenging, and that, many of you are seeing your routine doctor's appointments being rescheduled. We here at the Good Health Gateway are here to help. We want to help. And therefore, if you have a diabetes lab or exam that's due between March 1st and April 30th, you will receive an extra 60-day grace period with the program. If you are using the website, your diabetes care activity table on the site is going to automatically update to reflect this change with your labs and exams dates. But if you have any additional questions about the program or your extension, please call our helpline at 800-643-8028. So turning our attention back to the presentation today on popular diets, we had a lot of requests from members this year in our annual satisfaction survey to provide more information about diets and nutrition. So we really hope that the information we provide today will be helpful to you in making your food choices. Today we're going to cover some popular diets, including the Keto Diet, vegan or vegetarian, Mediterranean, the DASH diet, as well as the plate method. If you have questions throughout the presentation today, you can submit them through the questions section of the GoToWebinar platform. And if time allows, we will address some of the questions that come in at the conclusion of the webinar. In addition, at the end of the presentation, we will provide you with some general information about the Good Health Gateway program and the benefits of participating. So with that being said, let's proceed with the presentation. Before we get started, I would like to introduce myself. My name is Sarah Costa, and I'm a senior manager here at the Good Health Gateway. I will be moderating today's webinar. I'm joined by Lindsay Baker. Lindsay has been a practicing registered dietitian for over 15 years. She uses a non-diet and health at every size approach that is unique to each person. She received a Bachelor of Science degree in Nutrition and Dietetics, a Master of Science degree in Nutrition and Food Science, and completed her didactic dietetic internship at the University of Rhode Island. Lindsay is board certified both locally and nationally as a diabetes educator and works with clients with type 1, type 2, and gestational diabetes. She's also a certified intuitive eating counselor. Throughout her career, she has gained experience working with eating disorders, disordered eating, and chronic dieting. She also works with clients to manage other health concerns, including elevated blood pressure, cholesterol, and cardiovascular disease, as well as gastrointestinal issues. She aims to help individuals work towards a healthier relationship with food and their body to achieve not only better quality of life, but also improved health outcomes. So with that being said, I'm going to turn the presentation over to Lindsay, who is going to review our first diet. Lindsay?
Thank you, Sarah. Just want to say hello to everyone and thank you for having me. I'm really happy to be here today to talk a little bit about some trending diets. It's certainly something I discuss with clients in office frequently. Clients oftentimes have a lot of questions about diets, especially things that are trending now, and kind of how, what my thoughts are and how that might apply to them. So this is a great topic. So the first diet we want to cover is the keto diet or ketogenic diet. I think this is a great place to start just because with the current trend in dieting, this is certainly, I would say, the most talked about at this time. Keto diet is basically a high fat, moderate protein, and very low carbohydrate diet that places our body into ketosis. So in a typical day, our brain, our nervous system, our red blood cells, they rely on glucose from carbohydrate foods for energy, basically to just function efficiently every day. So kind of like gas to our car. That's what glucose is to those parts of our body. And so we use them basically 24 hours a day, but we also store glucose in our liver, the cells of our muscles as well, that those storage areas help our body function during long periods of time without food, for instance, when we're sleeping, but also helps us to perform physical activity, like activities of daily living, planned exercise, like aerobic exercise, running, walking, biking, and even things like strength training. So basically, when our body has inadequate energy from carbohydrate, or our carbohydrate intake is very, very low, it resorts to burning mostly fat for energy. And this results in a release of acids in our body called ketones. So these ketones are released, and essentially our body can excrete some of them through our urine so that they don't build up to a high or dangerous point in our body. But for perspective, a normal dietary intake for an adult, carbohydrate intake varies from about 45 to 65% of the total intake of a person. It really sounds like a lot, but if we think about carbohydrates, we're talking about fruit, vegetables, beans, lentils, grains, things like bread, cereals, rice, pasta, starchy vegetables like sweet potatoes, white potatoes, butternut squash, and things like milk and yogurt. So it's a really large portion of the foods that we're eating, especially foods that come from plants. So when we're in ketosis, it really involves a very low carbohydrate intake, about 50 grams a day or less. So for the average person, someone who's, let's say, requiring about 2,000 calories a day, 50 grams of carbohydrate would be, 10% or less of that total calorie intake. So we're talking very, very low carbohydrates. So some pros or benefits from the keto diet, of course, we're going to see a reduction in A1C and blood glucose levels. If we're not eating carbohydrates, we're going to definitely see a reduction in blood sugar. We may see some reduction in blood pressure, and people also see weight loss with ketosis as well. Cons, one major con that we see is really adherence. This is something that people struggle with. Most of the studies that we see for the keto diet are following people from 6 months to a year, so adherence is pretty difficult. Also, some potential for medical complications, things like constipation, kidney stones, even increases in our cardiovascular or our cardiovascular labs, like triglycerides, cholesterol levels can increase as well. And sometimes, oftentimes we see what we call overeating episodes with carbohydrates following a keto diet or a very restricted carbohydrate diet, because our body really relies on this energy source, so it can be pretty unnatural to go without. We also don't really have a lot of long-term outcomes from this diet, and so we do see some benefits, or the benefits that we do see that show up, at 3 to 6 months are not really seen at 12 to 24 months. So these are things to keep in mind in terms of, what we want to do for our long-term health with diabetes. Also, because of its restriction, sometimes, this great reduction and fast weight loss we see, because sometimes those benefits can be temporary. We may see an increase in overeating episodes. So what happens is we see wide swings of our blood sugar and weight going up and down. And those types of swings can really be more damaging to our long-term health and the health of someone with diabetes as well. So if we move on to vegan, vegetarian diets, these are diets that are full of fruits and vegetables, also other plant foods like protein sources and fat sources that come from plants. So we have veganism, which is very strict. No animal products are consumed for someone that is practicing veganism. So their protein sources are going to come all from plants, things like nuts and seeds, beans, hummus, quinoa, for instance, and other types of grains that are good sources of protein. And then we have vegetarianism, which can actually be somewhat flexible. So some vegetarians will eat protein like milk and eggs or fish. Sometimes we have vegetarians that don't eat any meat, but will eat milk, eggs, and fish. Or sometimes, people can be flexible where they might consume, let's say, plant sources of foods, 5 or 6 days a week, and limit animal sources to 1 or 2 days. But essentially, we're talking about an increase in plant foods. So with this plant-based way of eating, definitely we may see a lower risk of diabetes for those that have pre-diabetes, which is obviously something that is a benefit. And we also see the potential for lower blood sugar levels, so lower A1C, as well as, daily blood glucose levels, reduced risk of, or reduced incidence of blood pressure. So lower blood pressure, lower risk of cardiovascular disease or heart disease, which is also really a strong benefit for individuals with diabetes, because having diabetes puts someone at a greater risk for cardiovascular disease. And so if we can reduce that risk with plants and foods that come from plants, that's always going to be a benefit. So some of the cons with veganism: this is a very restricted diet, and this can be difficult. Oftentimes, this may involve some supplementation as well. If someone is new to veganism or is really not familiar, or having a wider variety of plant foods. And so sometimes those individuals may need to supplement with certain nutrients that we only get from meat. And then also, sometimes we can see some increases in gastrointestinal discomfort when we're eating an intake that's much higher in fiber. The other thing is that there's not really much greater significant benefit from eating, let's say, a vegan or vegetarian diet from other dietary plans in terms of their, results with our blood glucose levels, cardiovascular disease. And so it's good to note that, just eating more plants can actually be beneficial for us, and it may not always be necessary to become a full vegan or vegetarian. And yeah, just some people, people are different and their needs are different. And sometimes it's helpful to consider that if we're eating more plants, we're eating more carbohydrate foods as well. And so sometimes this is helpful to account for with, oral medications or insulin needs that might have to be adjusted if someone is wanting to eat more plant-based foods as well. So if we move on to the Mediterranean diet, Mediterranean diet really emphasizes, again, just more plants. So you're going to start to see a trend a little bit here. So more vegetables and fruit, things like beans, lentils, whole grains, really a decreased intake of red meat, and almost kind of substituting or encouraging an intake of seafood, especially fish that has omega-3 fat, like salmon and tuna. The Mediterranean diet is also has a large proportion of what we call monounsaturated fat. So olive oil is heavily used in the Mediterranean diet, and also things like olives, nuts, and seeds. These are going to contribute to that heart-healthy monounsaturated fat. Typically, again, we're going to focus on choosing more whole grains, less refined foods with the Mediterranean diet. And so because of these specific, food choices associated with this diet, certainly people, there is some reduction in things like fasting blood glucose levels for individuals with diabetes. We also see a reduction of cardiovascular disease risk, so lower cholesterol and risk of things like heart attack or stroke. And a lot of this benefit from the cardiovascular disease risk really comes from those healthy fats, those monounsaturated fats from olive oil and nuts. And so, again, this is great for individuals with diabetes, really reducing that risk of cardiovascular disease as much as possible. And we also, may see a reduction in A1C as well. Some cons about the Mediterranean diet is that it can be a little bit less effective at lowering A1C compared to other diets. This could be, something that is actually more of a long-term effect. A1C may be lowered more long-term versus, fast reductions that we might see on something like the keto diet or something really low carb. However, the other thing is that the Mediterranean diet, doesn't always come with a structured program. And for some people, that can be a con if there are like specific guidance on, certain types of foods and how much, taking that into consideration. So if we move on to the DASH diet. So the DASH diet, DASH stands for the Dietary Approach to Stop Hypertension. And this is a diet that was created and studied and found to reduce hypertension or blood pressure in individuals that were following this dietary approach. And so, as you might imagine, the DASH diet is low in sodium. And so that is the main focus, is reducing salt or sodium intake, mostly by increasing plants again. So plant-based foods and foods that are more naturally occurring in nature, like fruits and vegetables, whole grains, beans, and legumes, choosing lean protein sources, and also, again, including those heart-healthy fats and oils, monounsaturated fat like olive oil and nuts and seeds, those types of things. So we certainly we do see improved blood pressure with the DASH diet, and also some potential to improve insulin resistance, which is great for individuals that have both type 1 and type 2 diabetes, because this can help sometimes reduce medication or insulin requirements. So sometimes an individual can take a little less insulin or adjust medication. That may be a possibility. Or even just preventing the need for more medication or more insulin in the future. We can also see weight loss as well. And this, when we're eating a lot of plants, we are going to be eating, a lot of dietary fiber, which is pretty filling. The other thing with the DASH diet is really focusing on low sodium intake. And so if we're really trying to reduce salt intake, that is going to require a lot less packaged or processed foods. And so some of those foods might be a little bit higher in calories. So we can sometimes limit those foods just by being more mindful of salt intake. So some cons, there can be a little bit of limited guidance with the DASH diet. There are some general recommendations, but those aren't always going to apply to everyone, because of course some people are going to have, need more food than others, depending on, how tall someone is, for instance, or how physically active they are. Sometimes it can be difficult to maintain, especially if someone is really requiring a very, very low sodium diet, sometimes like 1,500 milligrams or less per day. And so in some cases, that can require some tracking if it's really kind of a strict intake. This could possibly, be costly for some people as well if they're trying to, buy a lot of fresh produce, although that is something that, can be worked around. But it can also be costly because if we're trying to limit our intake of processed or packaged foods, or things like restaurant or takeout foods, which can be higher in sodium, then it is going to involve more meal planning and buying ingredients to prepare meals at home. And so, it's going to involve also more time and some cooking, ability to cook at home as well. So that can be something that can be limiting to individuals. So the next one we're going to talk about is the plate method, which is really just kind of a guide to meal planning, which helps people to just balance their meals with food groups that are going to offer nutritional value, but also satisfaction. And so the plate method really focuses on portioning a plate with a quarter whole grains, a quarter of lean protein, and then half the plate being filled with produce like vegetables and fruit. So this is, again, a great way to plan meals because an individual or a family can select recipes and things like that that they'd like to make for the week. It's a helpful way to manage portions without having to weigh or measure foods or do other kind of invasive portion management techniques. It's recommended by the American Diabetes Association, which is great because it's been shown to be able to help people kind of maintain their weight or maintain a healthy weight, avoid weight gain in the future, and also kind of keep blood glucose levels steady. We know also that if we're kind of aiming for some consistency with the amount of carbohydrates we're having at our meals and snacks, it can help with just better blood glucose control over time. So it can help with things like medication and insulin adjustment and, fitting in exercise and being able to manage blood glucose levels that way. So this is helpful for that as well. This is great because it also just helps with flexibility. People can pick the foods that they enjoy and kind of plug them into this, this plate. So things like dining out or social events, family meals, even being individualized to things like certain food preferences, even ethnic or cultural foods that an individual maybe is used to eating or growing up with. These foods can still be included in someone's daily food choices and just kind of balanced out that way. So it definitely allows for flexibility. This is also a great example to discuss the situation we're in right now with, the coronavirus and kind of having to, settle on less food choices in the grocery store or have to kind of use up some shelf-stable foods. This is the plate method is something that can be applied to, this option. We can stand or frozen or shelf-stable foods to still fill this plate with nutrient food options. And so I think this is another great example of how, we can still eat nutritious food, in the plate method, even in an uncertain time like this. So if we, move on to the next slide and just talk about what is the best choice. There's really, in terms of research or evidence, we don't really have a lot of evidence or research that shows us one diet being superior over another for diabetes management or for the health of an individual with diabetes. And partly that's because people's needs are different. Sometimes, individuals are going to be taking no medication to manage their blood sugar or oral medications or oral medications and insulin or just insulin. And so it's really difficult to kind of have this one size fits all with the best food choices or the best diet. Also, we want to consider, it's not always about one individual, but, a person might live with a spouse or family and children. And, we want to make sure, are the changes we're doing, are they serving me well? And am I able to implement them with my family and in my lifestyle? And, just asking oneself, like, these changes, are we able to maintain them? And how are we feeling doing these changes? Are we feeling good? And so those are really important things to consider when we're making changes to our dietary intake to improve our health. More moderate kind of small changes to food choices and physical activity typically wins out in the long-term health aspect versus things like fad diets and things that are going to offer really quick results or quick changes. They don't typically, we're seeing research as well, they really just don't typically lead to kind of long-term changes in things like weight management, for instance. So we want to kind of avoid the major ups and downs with our blood glucose levels or even like weight loss and regain. Because when we make more subtle changes, it usually impacts our health more positively in the long term. And so if you're wondering where to start, if you're looking for some more personalized nutrition information, you can always talk to a doctor and ask for a referral or a recommendation to a registered dietitian. Dietitians can also have extra specialty certifications including certified diabetes educator. And so that dietitian not only has the, training and education in dietetics, but that specialty and extra training in diabetes management as well. So that person would really be able to give you and work with you and talk and coming up with just some more personalized goals for your diabetes management. And that personalization is really important because, needs vary and nutrition recommendations can be adjusted for, that particular individual. And if your doctor or health practitioner really doesn't have a dietitian that they refer to or that they know of, you can always go onto the Academy of Nutrition and Dietetics website, which is eatright.org. At the top right-hand corner, there'll be a little button that says Find an Expert, and you can click on it and put in your zip code, and it will list dietitians in your area as well. And so that's another way to be able to find a professional in your area. Okay, so I'm going to send it back over to you, Sarah.
Thanks, Lindsay. That was really helpful. So I do want to mention before we talk a little bit about the Good Health Gateway program that we are going to be providing this webinar as a recording to everyone following the broadcast. So it will be available on our YouTube page, so more to come on that. But what is the Good Health Gateway program and why do we do this webinar? So the Good Health Gateway program is a diabetes program that rewards you for taking care of your diabetes and connecting with your provider. Throughout the year, we present different webinars to bring each member information that will help improve your health, prevent complications, and close gaps in care. Since this program is provided by your employer, each program is a little different, but to receive the rewards, members complete specific activities that align with the American Diabetes Association's guidelines for diabetes management. These activities include what you see on the screen here, so annual fasting blood lipid, annual diabetes foot exam, eye exam, annual urine protein test, twice yearly, the hemoglobin A1C. We also have access to a clinical pharmacist or diabetes nurse educator. And the good news is that any of the activities that you've had completed in the last 12 months will count towards meeting your program activities. The only requirement that varies by employer is meeting with one of our diabetes nurse educators or clinical pharmacist. But even if your program does not require this, they are still available to answer any questions that you may have about your care. Lastly, I do want to point out that our program is completely voluntary and confidential. No information is ever shared back with the employer about who's participating. And all family members on an employee's health plan are eligible. So that includes spouses, dependents, adult dependents, and child dependents as well. Anyone with a diagnosis of diabetes or prediabetes is eligible to participate. We want to reward you for taking care of your health. As I mentioned before, programs are available and offered through the employer, so rewards and requirements do vary. But check with our helpline or visit our website for more information about the program specific to your employer. All right, so that is the conclusion of the presentation today, but we do have just a couple of minutes here to answer a few questions that came in from our audience. So Lindsay, if you could answer this question that came in. We have, eating healthy is very expensive. How can I eat healthy on a budget?
Sure, I'm happy to answer that. So I think there are a couple things to consider with healthier eating. If you're budgeting, I think one thing that can really be helpful is just kind of coming up with a plan for meals that really mean like to cook, 2 meals a week on a Sunday, taking up, 6-8 hours of your time, but really just kind of thinking about a couple hours, maybe 2 options for lunch and 2 options for breakfast, things that might sound good, and really making a grocery list so that when you go to the store, you can buy those items, have them at home if you have time to prepare breakfast before you leave and pack a lunch. Because when we're making more meals at home, we really do end up saving money versus purchasing meals out, like going out to lunch or out to dinner. Certainly we can pre-plan ahead for maybe, a couple of times, like eating out for lunch with colleagues or with friends for dinner, because of course that's something that's, socially helpful. But yeah, even if we can just kind of make a list of a couple things that we want to prepare at home for lunches and dinners, and even breakfast, that can help save a lot of money. One other thing that I really like to bring up is that to feel free to buy fresh produce, yes, but frozen produce and shelf stable goods are really these types of they don't lack in nutrition. So I think sometimes there's some misinformation that goes around that things like canned produce or frozen produce is less nutritious, and that's really just simply not true. Frozen produce is a great option, especially in the winter when we don't have access to a lot of fresh produce. And canned produce can be a really great option. There's a lot of low sodium or no added salt vegetables available, and fruits that are canned in 100% fruit juice or in light syrup. Those are great options. So if you want to buy some fresh produce, that's great. And even mix in some shelf stable stuff, that's also wonderful. A lot of shelf stable things are nutritious and not expensive, like oats and peanut butter and beans and things like brown rice, nuts, these types of things. So just thinking, that they don't have to be kind of organic or fresh all the time to be nutritious.
All right. Thank you, Lindsay. So I know we are right up on the half hour here, so that is going to bring us to the conclusion of the presentation. Please know that if you did submit a question, we will respond to you individually following the presentation. And as I had mentioned, we will be providing a recorded version of this presentation via our Good Health Gateway YouTube page. So anyone that registered for the webinar will be receiving a link to the presentation. But I want to thank everyone for joining, and thank you to Lindsay for helping us and being our subject matter expert on popular diets. But I want everyone to have a safe and healthy rest of the day.